Hi everybody, this is Dr. Matt from Energize Physical Therapy. So today we're going to talk about hip replacements. Last time I talked about knee replacements, now we're going to focus on the hip. So unlike knee replacements, for hip replacements there's actually precautions depending on what technique the surgeon used to do your surgery. So usually there are two types, right? There's one called a posterior approach and one called an anterior approach. Now mostly the posterior approach will give you the precautions that you need to keep throughout after the surgery. And those precautions are going to be there to help you while your hip heals and all the muscles, the ligaments around the area heals before. That's why they put the precautions. So if you pass them, then you might risk having to do the surgery again. So it's very important to keep those precautions and to remember them and practice them until the time that you don't need them anymore. So we're going to focus on posterior hip precautions. Number one, what you cannot do is pretend this is my right hip that had the surgery. You cannot have the hip past 90 degrees. So right now I'm sitting about 90 degrees. If you're sitting, you usually should sit on a higher chair. You shouldn't sit on a chair that's so low that makes your hip come up like this. See, this is past 90 degrees. And if you're standing up and you're lifting the hip, it shouldn't go up like this, past 90 degrees. So another thing is that you shouldn't turn your foot in. Like you know how when they say you have a pigeon toe or coming in like this, you shouldn't turn your feet in like this. That's internal rotation. And another thing is that you cannot cross your legs. So a lot of people may be tempted to, I'm going to cross like this, or I'm going to bring the leg across. That's number 3. You can't have hip adduction, so bring the leg across and in like this. So these are the 3 precautions that you have to really maintain, especially after hip surgery. And if you have any questions about this, you can always contact us at 855-856-7885. Thank you.